Hello there, warriors. Have you ever wondered what is the real effect of high blood sugar when you have diabetes? Think of the nerves as tiny messengers that carry important signals between different parts of your body and your brain. With diabetes, high levels of sugar in the blood can damage these messengers over time. It's mainly because the high blood sugar levels in diabetes can harm the nerves or mess with how they work. Plus, other factors like smoking or high blood pressure can make it even worse. The nerve damage can happen anywhere in your body, but it often affects the nerves in your feet and legs the most. Imagine those messengers getting a bit lost or mixed up, causing strange sensations, or even making it hard for you to feel things in your feet and legs. You might feel tingling, like little sparks or buzzing sensations in your feet or hands. It can also feel like pins and needles or a burning sensation, almost as if your feet or hands are on fire. Some people also experience pain or discomfort, like sharp jabs or cramps. Ladies and gentlemen, there is no need to worry. Keeping an eye on your blood sugar levels is the key. It's like trying to keep the phone lines clear for those messengers to get through smoothly. Eating healthy, exercising, and taking medications as prescribed can help control blood sugar levels and protect your nerves. Stay tuned to discover the 3 effective tips to prevent diabetic neuropathy in this ultimate guide to high blood sugar and diabetes. Don't forget to subscribe to our channel. We look out for your health with amazing wellness tips for a healthy life, and we would love for you to be a part of our community of warriors. Number 1. Maintaining optimal blood pressure levels. Maintaining optimal blood pressure is a cornerstone of preventing diabetic neuropathy, a serious complication of diabetes that results from nerve damage and impaired sensation. High blood pressure ultimately damages blood vessels throughout the body, including those that supply nerves. When blood vessels become narrowed due to hypertension, they can impair blood flow to the nerves, leading to nerve damage and dysfunction. Controlling blood pressure within a healthy range helps preserve nerve function by ensuring adequate blood flow and oxygen delivery to nerve tissues. By minimizing vascular damage, optimal blood pressure levels decrease the risk of nerve damage associated with diabetes. Especially individuals with diabetes should monitor their blood pressure regularly, ideally at home using a reliable blood pressure monitor. Regular monitoring allows for early detection of any fluctuations or abnormalities in blood pressure levels. Aim to keep blood pressure below 130/80 mmHg, as recommended by healthcare providers for most people with diabetes. Engage in regular physical activity, such as brisk walking, swimming, cycling, or other aerobic exercises, for at least 30 minutes most days of the week. Exercise helps lower blood pressure, improve circulation, and promote overall cardiovascular health. Maintain a healthy weight or work towards achieving a healthy weight through a combination of regular physical activity and a nutritious diet. Excess body weight, especially abdominal obesity, is closely linked to hypertension and increased risk of diabetic neuropathy. Alcohol consumption can raise blood pressure and interfere with diabetes management. Limit alcoholic beverages to moderate levels or avoid them altogether, as recommended by healthcare providers. Practice stress-reducing techniques such as deep breathing exercises, meditation, yoga, or spending time on hobbies and activities that promote relaxation. Chronic stress can elevate blood pressure and negatively impact overall health. If prescribed blood pressure medications, take them as directed by healthcare providers. Adherence to medication regimens is essential for effectively controlling blood pressure and reducing the risk of complications, including diabetic neuropathy. Report any side effects or concerns about blood pressure medications to healthcare providers promptly. Adjustments to medication doses or alternative treatments may be necessary to achieve optimal blood pressure control while minimizing adverse effects. Number 2. Balanced nutritional diet. Diabetes is characterized by elevated blood sugar levels. A balanced and nutritional diet helps to regulate blood sugar levels, reducing the risk of diabetic neuropathy. Consistent intake of carbohydrates, proteins, and fats in appropriate proportions helps maintain steady blood glucose levels throughout the day. Certain nutrients are essential for nerve health and function. Including these nutrients in the diet can help prevent or delay the onset of diabetic neuropathy. Vitamins B12 and B6, antioxidants, and omega-3 fatty acids are particularly important for nerve health and can protect against nerve damage associated with diabetes. Key tips for a diabetic-friendly diet. Whole foods. Whole, unprocessed foods are rich in vitamins, minerals, fiber, and antioxidants that support overall health and well-being. Fruits, vegetables, whole grains, Lean proteins such as poultry, fish, tofu, and legumes, as well as healthy fats such as avocados, nuts, seeds, and olive oil, should form the foundation of a diabetic-friendly diet. These foods provide essential nutrients that nourish nerves and help maintain optimal nerve function. Carbohydrates. Carbohydrates ultimately are converted into glucose in our body after breaking down. For individuals with diabetes, this makes monitoring carbohydrate intake crucial for managing blood sugar levels. Choose complex carbohydrates with a low glycemic index, such as whole grains, legumes, and non-starchy vegetables, which are digested more slowly and cause a gradual rise in blood sugar levels. Focus on portion control and spacing out carbohydrate consumption throughout the day to prevent spikes and dips in blood glucose levels. Limit sodium and processed foods. High sodium intake can exacerbate hypertension and increase the risk of cardiovascular complications, especially for individuals with diabetes. Minimize consumption of processed and packaged foods that are high in sodium, as they often contain added sugars, unhealthy fats, and preservatives that can contribute to inflammation and nerve damage. Instead, opt for homemade meals prepared with fresh, whole ingredients and seasonings to control sodium intake and maximize nutrient content. By making small changes to the lifestyle and emphasizing whole, nutrient-dense foods, managing carbohydrate intake, and limiting sodium and processed foods, individuals with diabetes can support blood sugar control, nourish nerve health, and reduce the risk of complications associated with diabetic neuropathy. Number 3. Foot health and hygiene. The most risky concern with diabetic neuropathy is that it can lead to decreased sensation in the feet, making individuals less aware of injuries, infections, or abnormalities. Without proper care, minor foot issues can progress into serious complications, such as foot ulcers, infections, and even the need for amputation. The worst part is that it can go unnoticed until it has escalated into something serious due to lack of sensation. Regular foot examinations and daily self-inspections are essential for identifying any changes or abnormalities early for an individual with diabetes. Detecting problems promptly allows for timely intervention and prevention of serious complications. Inspect feet thoroughly every day for cuts, blisters, sores, redness, swelling, or any signs of infection. Use a mirror or ask for assistance if visibility is limited, especially for areas of the feet that are difficult to see. Wear properly fitting shoes with adequate support and cushioning to reduce pressure and friction on the feet. Avoid tight, pointed, or high-heeled shoes, as they can cause discomfort and increase the risk of foot problems. Consider diabetic shoes or orthotic inserts to provide additional support and protection for the feet. Keep feet clean and moisturized to prevent dry skin and cracking, especially around the heels. Use a gentle moisturizer to hydrate the skin, but avoid applying moisturizer between the toes to prevent moisture buildup and fungal infections. Trim toenails straight across and file any sharp edges to prevent ingrown toenails. Do not cut nails too short or round the corners, as this can increase the risk of ingrown toenails. Seek professional foot care assistance for nail trimming if necessary, especially if you have difficulty reaching or seeing your feet. Schedule regular foot exams with a healthcare provider or podiatrist to assess foot health, monitor for changes, and promptly address concerns. Oh my dear warriors, diabetes is a major health concern, but that does not mean that your life has to be any less enjoyable if you have diabetes. With minor changes to your lifestyle, regular exercise, and a healthy nutritional diet, you can stay on top of your health through your golden ages and beyond. Keep a lookout for these effective tips if you have diabetes, or know someone who does to prevent any complications and enjoy a healthy life. Cheers to wellness and health. This is Wellness Warriors with another life-changing experience on how to take control of your healthy lifestyle. Please like, subscribe, and turn on the notifications so you don't miss out on the latest health tips and tricks to a better life. Thank you for watching. See you again next time on Wellness Warriors.